This is a 58-year-old patient with a lot of pain related to his severe osteoarthritis of the patellofemoral joint. He had 2 years ago a patellar fracture, and the ACL reconstruction was several years ago. But he has a lot of pain, he cannot walk nicely, he wants to do a lot of sports like skiing, hiking and so on. So these are the best indication if the osteoarthritis is really related to the patellofemoral joint. Now we started here with a medial incision, and to medial incision we skip the patella to the side, we debride the patella, remove all the osteophytes, we do some partial synovectomy, some denervation with the electrothermal device, also to prevent further degeneration of the remaining cartilage. You see with the electrocoder device you can clearly dissect all the hypertrophic synovitis. And then we have to measure the trochlear depths with this guide here. We can measure here, we have two possibilities, 4.0 and 5.0. And then we measure the groove of the trochlea in the AP direction. We have 4 possibilities. So that's why we have a lot of different possibilities to place inlay, really anatomically, not an onlay, it should be an inlay, and we prevent most of the cartilage we can. Now with this offset drill guide in an AP direction, we measure the central trochlear groove, place a key wire inside, and then again measuring the groove of the trochlea with this. The drill guide will help you to position the inlay precisely. There are several tools now to measure this groove. This is a yellow sleeve, a so-called offset sleeve over the guide, and also the contact probe can give you the precise diameter in the AP and in the sagittal diameter. You can clearly see how deep it is, and then you can plan what size of implant you would like to use. Now we use the central reamer, 35 mm, going over the drill and ream until we have reached the depths of 4 or 5 mm what we measured before. With this central reamer now we will see exactly how deep we are. It should be flush to the medial and lateral facet. We clean it, we wash it out. We select the guide block that corresponds with the offset from the superior and inferior mapping, and you can clearly see medial and lateral and also the depths 4 or 5 mm before you place it and align it. Then you have to fix it really secure with 6 key wire, very small key wires, because this guide wire now, this guide will now keep you the reamer in the correct position. We have to ream it twice, inferior and superior, so we will have to save and to fix it securely, as you can see now. And this is a small scalpel, a circular scalpel. We try to cut the cartilage precisely before we use the reaming device. To keep this reamer perpendicular into this guide, we have a special device, this white device here. You can fix it in the guide, and then you can use the same drilling device. You ream. You cannot ream too deep because it has a stop at the end. You do it superior and inferior. You clean it out. Now we place the same device on the inferior part of the guide. Again we ream to the precise depths. And now you may understand that it's so important that you keep this drill guide, this guide block, very safe. And now this is the same reamer we used before. It's the edge reamer. Again, we need clear cut at the end. The implant should be really flush to the cartilage. We do not want some hopping or clicking when the patella is going into the trochlea. Now you can see how precise we drilled everything. This is the reaming device, the edge cutting device. We clean it here very safely, and now this is already the sample device. You see that now you can again change it. If you don't like it, you can go deeper or use a bigger one if you don't like it. You also can see that the little bit offset, because the trochlear groove is not really in the center of the condyles. With this sleeve now, we place again a central key wire with the machine to place it correctly and be safe before we over drill it now to place the screw inside. You take away this handle. We have still the sleeve inside, and over the sleeve now we over drill it. That will be our next step when we use the screw, the central screw, for fixation of the replacement. Now with this tab we prepare the location of the screw. Again, it's very precise, and now the central key wire is coming out, so you cannot be too deep, because it tells you how deep you are. So again, clean it precisely, wash it out, take out the central key wire, and now the screw is already going in, again with the same handle device. It goes in the center of this sample we placed before. We fix it a little bit to be sure that it's placed correctly. It's locked now. Take it away. Take away the handle device, and now you can see the screw. That's now the final screw. We control it if the placement of the screw is correct. It shouldn't be too deep or too high. And again, you can take this sample away. We take the key wire away, and now we will just have the final step. You see the screw. We clean a little bit the surrounding of the screw before we place our implant, our definitive or final implant. This is the implant now. We place it correctly, perpendicular to the screw, and that's it. Now this implant is correctly placed and it's perpendicular to the screw. We have no gap, we have no oversizing or overstuffing of the implant. Control it, the patella is going back. This is the final X-ray of this patient after the surgery, and it shows us the perfect implantation of this inlay, the wave. There is no blocking, no gapping, especially no overstuffing like other patellofemoral joint replacement. And finally, I would like to thank all the people who helped me doing this video.